Hello, everyone. My chosen public policy is prescription and illegal drug overdose prevention. In the United States, there is a opioid epidemic that is sweeping the nation. Especially here in Baltimore, Maryland, there has been hundreds of overdoses within the past year. Um, and within the past year, I know at least 2 to 3 people that have died of overdoses. So overdoses need to be overdoses need to be talked about because it is such a large problem in the United States. So, who does this issue affect? The short answer is everyone. Not only is it the family members, but it's also friends close to the using individual. And this is pretty self explanatory, but it is also the individual that is using the drug because it also takes a toll on their body. Research has shown that prolonged opioid exposure is detrimental to one's health. However, in short term use, it can help pain, for example, post operative, in or especially in orthopedics where you need some sort of pain relief. So, what is the impact of overdosing on the community? So, overdosing definitely creates concern amongst the community. It also creates a need for the use of Narcan amongst citizens, especially citizens that know that overdoses are a large problem in the United States, and within their own community. So it also creates a need for education regarding illegal and prescription drug use. Not only opioids are Ill, are in illegal substances like heroin, they're also in prescription drugs like morphine. That can be um, very addictive if the doctor does not prescribe the medication correctly. So, why does overdosing need to be addressed? I have here a graph that shows the number of deaths regarding opioids. So, in this is 2012. As you can see, there are almost 1,600 overdoses. This is just in Maryland. Um, this is just in Maryland, and from fentanyl, which is a illegal additive in heroin that because it is cheaper than the actual heroin. So you have fentanyl, which is quite a large number. Then actually heroin has come down since 2011. Oop, okay. And then you have cocaine, alcohol, prescription opioids, and benzodiazepines. Um, so here is the actual numbers. So, I'm sorry, that was 2017. In 2017, there were 1,594 overdoses from fentanyl. And as you can see, in 2007, these numbers have drastically increased by the thousands. This is just in Maryland, as you can see down here. Maryland is a very hard state on overdoses. And after fentanyl, heroin is our next killer at 1,078. And as you can tell, that number has drastically increased as well in 2007. overall, you can tell a trend of increases in overdosing on these various drugs. However, resources have also been reached out within the community. So, who will be affected by the Maryland Opioid Overdose Prevention Plan? Short answer is the entire community. And also, like I said earlier, the family members of the using individuals and the friends of the using individual. All of these people will be affected because most likely they will be borrowing money and other things to help their addiction. So, how will the opioid overdose prevention policy affect these overdoses? Optimally, this policy would stop overdoses, but realistically, this policy would slightly reduce the amount of overdoses among the state of Maryland. This would allow the officials of the healthcare facility to reach out to the community to expand their resources for recovery. This would also allow Medicaid to expand their resources because this treatment is very expensive. So, I will get onto the cost of this treatment later in the presentation. So, what will change by enacting the opioid overdose prevention policy? For example, the amount of opioid that physicians can prescribe. Under this policy, one of the major improvements include enforcing stricter regulation of opioids prescribed by physicians. Under this policy, it also creates a need for community outreach programs to promote recovery amongst the community. In fact, prescription opioids are just as addictive as illegals because it is pretty much the same substance. So, what are the costs of the Maryland Opioid Prevention Plan? So, in fiscal year 2012, nearly 50,000 people received addiction treatments sponsored by Medicaid or grant-funded opportunities, and that came directly from the Maryland Opioid Overdose Prevention Plan. On page 5, Medicaid spent $97,520,628 in fiscal year 2012 on addiction treatment. That number has drastically increased by 190% from fiscal year 2009. That's just 3 years. And, for example, just to show how much our spending has gone up on addiction treatment, $33,663,362 was spent in fiscal year 2009 on addiction treatment. That is triple the number in just the 3 years. So why are we allowing these overdoses to get so bad? That is where the Maryland Opioid Overdose Prevention Plan comes in. What are the benefits? The benefits are simple. When this plan is put into effect, there will be a defined decrease in the overdoses. These overdoses include illegal and prescription drugs. So, what are the risks? So, if we do not enact this policy, there will be a constant increase in overdoses in the state of Maryland. However, as earlier stated, despite the enactment of this plan in 2012, there was a 190% increase from 2009. So why is that? It is because the physicians are not being regulated by the amount of prescriptions they are allowed to prescribe. That is what this plan is for. The DEA now regulates how many opioids physicians can prescribe. So, how will the lives of people who are affected by the issue change if this policy is enacted? Most likely, this policy would be life-saving for the using individual. This will also be life-altering for the patient's family because of the not worrying about a phone call that their loved one is um dead because of an overdose. However, this policy will be expensive because of the extended amount of time needed for the treatment of addiction. So, and there are my references. Um, so what is some information about this policy that would potentially affect the voting behavior of legislatures from across the political spectrum? So, I believe throughout conservative, moderate, liberal, progressive, all of those different parties, we all can agree that overdoses are awful for the community and they are devastating, and it is a, an epidemic among the country. So I believe that just based upon that, we can agree that this policy needs to be enacted. I believe that important messages would include personal personal stories from family members that have died from overdoses, and even people that have survived overdoses and are now in recovery can tell them that if they can change their mind. So thank you for your time today, and I hope that you will be able to vote for this policy because I believe that it would be life saving. Thank you.